review.
So today we want to talk about the illegal practices by some Nigerian pharmacists. Illegal practices, yes. The Section 2 of the Medical and Dental Practitioners Act clearly stipulates the council that will manage or that will control the knowledge and skill required in medical practice. But today, what do we have in our different, health, establishments? Nigeria remains the only country where somebody wakes up in the morning or anytime the person goes to a pharmacy shop to tell them the drug he wants to buy. I'm making this video because it's really disheartening. I have a friend who I was supposed to go for a contract bid one day. I was calling him in the morning. He was not picking his call. Luckily, I had the wife's number. I called the wife. Said, my friend nearly died in the night. That he was complaining of headache. He went to a pharmacy shop and they treated him with, or rather they treated him for malaria because they do not have clinical knowledge. They believe every headache fever must be caused by malaria, which is endemic. Yes, this tropical region. Now, this my friend was having symptoms of high blood pressure. So, after treating malaria, taking the first dose, in the night, the man became unconscious. Thank God that the wife was very observant, discovered it, and they rushed him to a nearby hospital where it was diagnosed that he had what we call cerebrovascular disease. And it was hemorrhagic. So, of course, some part of his body got paralyzed. When I got the information, I went to the hospital. I met with the managing team and they told me what happened. CT scan was done and so on and so forth. But this man was having the symptoms. He was having the signs. You cannot just have stroke. These things will be giving you the symptoms. These pharmacists are not clinically trained to handle patients. They are not. It's only in this country, Nigeria, where such rubbish occurs. Because they have seen the weakness of the body, statutorily empowered to manage medical practice. They've seen the weakness. Is it not the same Nigeria where a fake doctor was working with Federal Ministry of Health? If you have gone to Federal Ministry of Health, you see it is located at the 3-arms zone. 3-arms zone, as we have 3 arms in the government: the executive, the legislature, and the judiciary. Federal secretariats. See here, you see National Assembly. Here, you see House of Court. Here, you see Supreme Court. The 3 arms of the government. Somebody worked there for how many years? He was not discovered. In fact, they even managed to bring that matter to public, knowledge. When I think he was having issues with some of his colleagues. That is in Nigeria where we are. They have seen how weak the body empowered to regulate medical practice is. That's why you see all this rubbish. So that my friend would have lost his life, assuming that he did not have a wife who was observant, who immediately took him to the hospital. Everything doesn't end, every headache doesn't end up as malaria and the typhoid, as they may foolishly tell you. I traveled to Jerusalem. I needed to buy paracetamol for something. I was just having, mild fever. So I felt good. let me just buy paracetamol. I went to a pharmacy shop there. Surprisingly, as I got in there, the person minding the pharmacy asked me, where is my prescription? I was so confused. I said, I'm talking of paracetamol. The person said, yes, he knew. So, where was my prescription? So I was like, prescription, how? Okay, I said, maybe paracetamol, maybe a brand name here. So it's not generic or pharmacologic name. Let me tell you the pharmacologic name. I say, I want acetaminophen, which is the generic name. At the end of the day, do you know what this person told me? This person said that, Mr. Man, as it stands now, that he brought the drug, so I shouldn't be fooling myself. Is it not this drug you are looking for? I said, yes, that is it. He said, I needed a prescription. I thought they were joking. I called my friend practicing in Tel Aviv. I said, come on, I went to a shop and this was what they were saying. Though I wanted to go to another shop, he said, there's no need to bother myself. That very place, the truth of the whole matter is, there is nothing, when I say nothing, I mean absolutely nothing, that I could do in Israel unless I should get a doctor's prescription. Without the doctor's prescription, nothing would happen. He had to write the prescription, sent it to me before I could buy paracetamol. But in Nigeria, they will tell you it is OTC. OTC meaning over-the-counter drug. Let me tell you, you can use paracetamol to commit suicide. It's just for me to tell you the dose. That is why nobody should buy any drug without seeing a doctor. Nobody should run any test without seeing a doctor. In Nigeria here, anything happens. And the National Assembly too is not helping matters. Because any dick and Harry in the health sector, just carry your act, go there, they will enact it. Yes, I'm not ignorant of Section 4 of the Nigerian Constitution as amended, which vests the legislative powers of the Federation in the National Assembly. That is Section 4, subsection 1, and equally declares that the National Assembly should have House of the Senate and the House of Representatives, that is bicameral legislature. I'm aware of that, and I'm also aware of Section 4, subsection 2, that empowers them to make laws for the peace, order, blah, blah, blah of the Federation. I'm aware of it. But what I'm saying is, in my other video, I will have another video for the National Assembly, how they are destroying the health sector, especially the public health sector. But that is by the way. Now, we cannot forget easily, in 2012, how a promising young Nigerian lady, Cynthia Oskok, was murdered by her Facebook friends. Remember, before then, she was a student of Nasarawa State University, KEFI, a master degree student, MSc student. They lured her to one hotel in Festac. Those people didn't, the murderers didn't do it alone, without the help of a pharmacist. Yes, one Ositoji. It was in the news, and it is still in the news. Those people bought a sedative drug called Rohypnol. This Rohypnol, they used it to sedate the lady, to hypnotize her, and for them to carry out their murderous acts. They killed her. And I thank God that the police that handled the matter did not leave any stone unturned, because they made sure that everybody involved, even the relative of the murderer that collected property belonging to Cynthia Osokok, they were arrested and arraigned him with the murderers along with the pharmacists. However, at the end of the case, in the High Court, they acquitted the pharmacist. I don't know the reason why he was acquitted. I did not know the reason. The trial judge say that the pharmacist was right in selling a drug that required prescription without prescription. So that is the Nigeria where we find ourselves. We are talking about terrorism, Boko Haram, the one we have in medical practice, the one that these pharmacists are doing. I think it should surpass the killings by bandits, armed robbers, and kidnappers in Nigeria. Because if somebody wakes up in the morning and goes to a pharmacy shop, tells them the drug he wants to buy, that is self-medication. I've told you my experience in Israel. We are a medical. When I told them I'm a medical doctor, brought my said you can go online see my publications, but they said calm down. Yeah, we don't sell drugs without prescription. But here, what we have in Nigeria, you see pharmacy shops springing up here and there. You can go there buy drugs. Even the doctor gives you prescription, you can use it to refill your drug after you finish that. When the true thing is, when you see a doctor, the doctor cannot just prescribe a drug. The doctor wants to find out. And just like that, my friend that had stroke, while they are treating him for malaria, if that my friend had gone to a hospital, these things will be picked from the beginning. Because in the hospital, before doctor sees you, there must be what we call vital signs. These things will pick out some things that some people can come for another thing. Maybe you want to do blood donation, another thing altogether, another thing will be discovered. Because this is clinical practice. There is a procedure. That procedure, things that should be done before you see a doctor. And in the process, you start discovering. Most people go to hospital for a particular thing, and other things will be discovered. Some people never knew that they had cancer. Some people that are HIV positive today, they were having fever, which are the common symptoms, having fever, having this and that. And at the end of the day, when they come, because there are baseline investigations, and the course of those investigations, the doctor who is clinically trained will be able to find out what is your problem. But in Nigeria, you just go to a pharmacy, tell them what you want, they will sell it. Because those people there, they are being paid according to the turnover. That is what we have here in Nigeria. And when you want to talk, but this is a law empowering you. Which law are we talking about? Who are these people making this law? Do they travel? Come on, Benin Republic here. Our closest neighbor. You dare not buy drugs without the prescription by a doctor. I had a lady that was brought to the hospital. She was pregnant. She was having what we call threatened miscarriage. She rushed to a pharmacy shop. The person there gave Buscopan, believing that every stomach upset. And that hyoscine has pharmacologic function of relaxing the lower uterine segment. And the woman aborted the baby. The baby went. Somebody who had been barren for years and suddenly conceived. That was how she ended that pregnancy. These things are happening. Now, you can look at it. Who are the people? Go to pharmacy shops. You see people on IV, intravenous infusions. People on injection. Do they have that right? Where in the Pharmacists Council of Pharmacists Council of Nigerian Act? Where? Even the one they got in 2022. Where does it empower them? If you go to section 4 there, it tells you their rule, what the council should do. Section 4 of the Pharmacists Council of Nigeria Act, it will tell you their function. So, does a pharmacy have the right to be the first person to meet a patient and sell a drug without history taking, without clinical examination, without investigations, without interpretation of the investigations? This is happening in Nigeria. And many people are dying. When we talk about the lifespan, why won't the lifespan of Nigerians be short when all these things are there? Nobody speaks. If you expect the State Minister of Health, who is empowered to control medical practice, they won't talk. Then if you go to the office of the Director of Medical Services, who is under the Federal State Minister of Health, who is supposed to move around, check the standard of hospitals, they sit down in their offices waiting for the salaries. So nobody, that's why you have more quacks in Nigeria. you have more of them. I had an uncle who all this while we believe he was a doctor. Imagine when I finished my medical training, my mother told me that come, you have to go and see your maternal uncle. At least for him to put me through. I had to travel many states in order to go and see him. Luckily, the man was sensible. When he saw me, he told me, look, I'm a registered nurse, but I've worked in then Ebonyi State University Teaching Hospital for years before retiring. So he had knowledge. So some of his patients, that's why he opened a small clinic, a nurse. He went straight because he knew lying to me would bring more lies, and at the end of it, I would find out. And the respect I had for him might, start to decrease. So that is Nigeria. That is Nigeria. If you go to other countries, pharmacists will be in the hospital because these people are trained to take care of drug manufacture, how to manufacture drugs, how to constitute drugs with little or no clinical knowledge. Now, they are the ones in Nigeria that are selling drugs. Just go there, tell them what you need, they will sell drugs. That is for people that even have God in their conscience. Because if you go there, you see auxiliary nurses. Auxiliary nurses, yes, that are dispensing drugs. I don't talk, I'm not the one that I'm not the person that will tell you go to court. When you come to me, if you challenge what I'm telling you, come to me. I take you to pharmacies. You verify. This one is not like I don't need Pharmacy Council of Nigeria or the association to come and reply me. If you challenge me, what I'll give you practical stuff. You come, we move to pharmacies. You see those people dispensing drug are auxiliary nurses. I don't tell you, it's clear. You understand? And they are paid based on what they generate. The more you generate, the more there is more revenue coming through you. Then you are going to have more pay. That's Nigeria. About more than 90% of the drugs we use in Nigeria are imported from different countries. India, China, this. In Nigeria. Now the question is, these people, would they concentrate on their calling? That's why my good friend, who is the current World Medical Association president, as Enabuleme, he was NMA national president. He was calling them drug counters. We are seeking for consultancy level in public hospital. On what? What do you want to consult? You sit down, you are counting drugs. Go to other places. Go to other places. Most of the drugs they use are manufactured. Before you talk about being a professor in this area, what have you done? In Nigeria, doctors are called consultants after passing their fellowship exams, and you want to answer a consultant immediately. Where is it done? Usurps solution we use is produced by University of Edinburgh. Yes, they are the ones that produce it. So you see a lot of our teaching hospitals buying drugs. Which one are they producing? The ones, at least, let's forget about others buying from. Can you produce the ones you use within the hospital equipment? Everybody wants to come to medical practice. I'm not telling you stories, it's not a fairy tale. I say, I'm giving a challenge to anybody. Don't reply my video. What you need, say, Dr. Paul, you are lying. I will take you to pharmacies. You see where people line up for injections. Do they have the right to give injections? Do they have the right to give, to sell drugs without prescriptions? Do they have the right to refill a patient drugs with old prescription? Because the rule is simple. If you come to the hospital, the doctor prescribes drug after investigations and so on and so on. When he's satisfied with the diagnosis, he makes a prescription. When that prescription is made, then the doctor asks you to go and come back 2 weeks time. Most patients don't come back 2 weeks. They will disappear. They would rather use the prescription to go and buy another drug without knowing that you are killing yourself. Because the doctor wants to know first. The doctor cannot look at you and say, this drug is working or is not working. By giving you 2-3 weeks to come back, he wants to know that drug is working. Because drugs come in classes. There are different classes of drugs treating the same thing. You may not respond to a particular class, that makes the doctor to move to another class. Or you may be responding, but you are not responding to that dose, the dosage. The doctor may decide to go up or come down. If you over-respond, the doctor may decide to reduce that very dose. But it doesn't occur in Nigeria. Walk into anywhere, just buy anything you want to buy, and the people statutorily empowered to regulate medical practices in Nigeria are in their offices, and anything happens. Please, in the next video, right? This is the first video. The second one, I will cool down and give examples concerning this. Thank you once more.
Preview.
Please remember to comment, like, subscribe, and share. Thank you.